Good evening. Welcome to Door County Live here on Door County Medical Center's Facebook page. Sorry for the delay. We had a little bit of a technical glitch, which seems to be becoming more and more of a common thing. I'm Dr. Jim Heise, Chief Medical Officer here at Door County Medical Center, and I'm joined once again by Sue Powers, Public Health Officer and Public Health Manager, which I always tend to manage to somehow goof up a little bit, but
it's too long of a title. You got
no,
it, though.
it's nice. It's good. So thank you so much for joining us. It's
you.
been a while. So what we're going to do is, I suspect that the big topic of questions that people will have is related to vaccines. So we'll certainly look forward to those questions. But I thought what we'd do is we'd start out with Sue just giving us an update as to where things are in the county. Things are kind of heading in a positive direction for right now, but I'll let Sue take off and I'll get us situated for questions.
Right, yeah. Case numbers are basically down a little bit across the state for a couple of weeks now. Most of the counties across the state are down to the very high metric level rather than the critically high, and so that includes us in Door County. The percent of positivity for testing for the last week is 9.1% in Door County and 10.6% across the state, so that is also down. What does this all mean for us right here? Well, roughly mid-October to mid-November, we were running 30 to 40 plus cases a day, and in the last couple of weeks, we had one day with 25 cases. Otherwise, we're about 5 to 18 cases a day, which is much less, much better, much more workable. We've been back to mostly doing full contact tracing on all those cases. We currently have 8 limited term employee contact tracers working with us. That's been a great help. Yeah, things are looking better, headed in the right direction.
Yeah, we'll take that. That's for sure. So it's always nice to see a downward trend after things had really gotten it just up to a fever pitch, and especially here at the hospital, we had reached a point where we literally were at capacity, but we were able to manage through that. I often tell the story about how here at Door County Medical Center, we're a critical access hospital with 25 licensed beds. And at, I think, the peak, we had 32 patients in our 25-bed hospital. We're really fortunate in that we have physical space to put people. We have our dedicated COVID isolation unit, which is the old ICU prior to the bed tower that we're sitting in right now being constructed back in 2010. But the big limiting step has always been the staff to run it. You need the skilled, you need nurses, and you need technicians, respiratory therapists, things like that to adequately take care of people that are in need. So we've been really fortunate in that we've been able to do that. And I'm kind of proud of that fact because we've been able to really manage through it. So we're hoping that we don't get back to that. And so the trend that we're seeing now, I hope we can sustain. I think it's really up to us. I mean, I think right now we have a very nice, inviting light at the end of the tunnel with vaccines. And I think if we can just get through the winter months, I think we're going to start to see smoother sailing. So, and I think being in a smaller area, I think we have every ability to manage through this. I really do. I think if we all make the right choices, and if you're going to go out in public, continue to wear those masks, continue to try and physically distance, things like that. If we do those things, it's I think we can sort of maintain the gains that we've had. Do you want to talk about, Sue, from a public health perspective? I think it'll be kind of a good, maybe what I'll ask you is from a public health perspective, what advice do you give to folks in general about Christmas, about the holidays? And then what I'll do, I know what Sue will say from a public health perspective, and then I'll just say what I've been saying on the radio, and we can have a conversation about that. Not that we don't disagree at all. It just has to do with what she has to do in her role and what I do. But I think it would be a good place to start. Why don't you let us know what public health's position is on that?
Yeah. Well, what you just described about distancing, masking, and hand washing, I don't know if you said all those are the usual things, and stay home as much as possible. I heard a new phrase for that today, good pandemic behavior. I kind of like that, it kind of sums it up. And that's really what we're advising for the holidays. Do your visits virtually. Don't interact with anyone outside of your household. If you do, please know that it's a risk.
Yeah.
Whether they're related to you or not, it's still a risk if they are not inside of your household.
Yeah. And that's kind of, that's what I was referring to when I said, you know, what, and Sue basically said exactly what I would say. I tend to focus more on, you know, there are some people that will really vociferously talk against, you know, how dare you tell me I can't get together with my family? And I always say, I don't think anyone is saying that. I think we're here to give you the best advice that we possibly can give you. If you feel that it's important to get together with your family, I think do exactly as Sue said. Understand that there's risk. There's never zero risk in life, but understand that there's risk to that. But I would also hope that at the same time that you understand the risk, that you make smart choices. So things like wear a mask when you're in someone else's home. Do your best to stay 6 feet apart. If you can open up windows, do that. Which I know sounds silly in the middle of winter, but the whole thing, the virus loves enclosed spaces. So if you can get yourself in a situation where you can avoid that, that makes the most sense. And there's really no argument to the fact that sort of thing works. We've seen it already. When people, you know, I have some people that I know that said, well, they referred to a group of people as their bubble. Well, what you don't realize, or what some people don't apparently realize, is that your bubble is not what you define. Your bubble essentially is the people with whom you live, those, you know, your direct immediate family. So I've had some people where they're within their bubble, they've gotten COVID. Thankfully, they're doing fine, but those are the things we have to think about.
And I think the other piece of that is if you do become symptomatic, please get tested.
Yeah.
We've seen so many people that just have very mild symptoms, or they're sure it's their allergies, or they're sure for one reason or another it's just a cold, and then they are positive.
So now we're getting a good group of questions. So I'll try, and some of these I'll try and kind of burn through pretty quickly. Have the vaccines arrived in Door County? No, they have not. We expect that they will be arriving in the next 24 to 36 hours, but we'll more on that in a minute. Jack asks, are there currently 10 staffed ICU beds at DCMC? How many are currently filled? We don't have 10 ICU beds. We actually have a 4-bed ICU here at Door County Medical Center. We have an additional space for 5 beds in our COVID isolation unit. And then we have 2 negative pressure rooms up on the medical surgical floor. So, you know, when this whole thing started, we were a little cagey about talking about number of beds and talking about, you know, where we put patients, with good reason, because what we didn't want to do is we didn't want to scare people. We didn't want people to say, because, you know, if you don't understand the context of all this, you're going to say, oh my God, there's only 4 ICU beds. How can you possibly take care of people with only 4 ICU beds? But I think now we've gotten through the worst of it, and you know, we've without any difficulty really managed it just fine. You have to understand, in a community our size, our average daily census, with the population in the county of 30 plus 40,000 people, including down into Kewaunee County, we have an average daily census before COVID of about 12, 13 people. So that number of people in the hospital, which is about what the population is. That would be the same thing percentage-wise down in the city. So normally it's very manageable. And I know, Sue, you have experience being an ICU nurse for many years here. So that's sort of the case. So you have 4 ICU beds, and they're not very often full. So do we have beds? Sure, we absolutely do. Any word on our nursing homes, CBRFs, and assisted living facilities receiving the vaccine? Have you heard anything, Sue?
I have. I have heard from a couple of our nursing homes, and they have gotten confirmation. So the process for long-term care facilities is that they partner with a pharmacy. Either CVS or Walgreens are doing this program. They partner with a pharmacy, and then the pharmacy provides the vaccines and actually vaccinates people for them. And so I've heard from several of our long-term care facilities, they've gotten confirmation that they are enrolled in the program. They've heard from their pharmacy partners. One of them has heard that their vaccine will be coming next week.
Yeah, I think that seems to be a theme, is that I think everyone is registered and set to go. I think a lot of it is just waiting for the allotment to come through. Corey asks, if a person is supposed to have a procedure like a colonoscopy or might like to give blood, how does getting the vaccine impact that? Do those things get delayed? Should the person postpone getting the shots? You want to take a stab at that, or you want me to?
Well, what I know is that if you're going to get the vaccine, it should not be at the same time you get another vaccine.
Right.
For whatever reason. So, at least 2 weeks between vaccines. But I'll let you answer.
Well, yeah, as far as colonoscopies and donating blood and things, there's nothing to say you couldn't do that at the same time you're getting a vaccination. So that shouldn't be a reason not to get it, or to do the procedure for that matter. Here Lisa asks, if you get vaccinated, do you have to continue to wear a mask?
Oh,
you
yes.
want to take that, and then I will
Yes.
add on it.
So, for a lot of reasons. First of all, whenever you get a vaccine, it takes 10 days, 2 weeks to build some immunity. With this vaccine, you need 2 doses to build maximum immunity. And they need to be either 3 or 4 weeks apart, depending which brand of vaccine you get. So that's a time period. The other consideration is that until we get to a level that a lot of people have gotten the vaccine and are immune, we should continue those precautions. Very important.
One of the things that, just a shameless self-plug, is if you haven't already had a chance to see it, go onto the Door County Medical Center Facebook site that you're on right now, watching this live, and there's a video that the marketing department and I did related to sort of the standard questions, or what we thought were standard questions for the vaccine, and that's covered in there as well. But one of the things that a person who Sue and I were talking before we started, there's a physician who's a vaccinologist. He's a pediatric infectious disease specialist. His name is Dr. Paul Offit. I really think the world of him, and he really puts things in ways that are understandable, and I've read a lot and that sort of thing. And the way he puts it that I really like is, we know that the vaccine prevents against disease. It does not prevent against infection. And what does that mean? How do you parse that out? Well, disease would be, it prevents against those things that would make you sick and hospitalize you. So you won't get the disease, you won't get the pneumonia, you won't get all the related stuff related to having COVID. You can still get infected. The possibility is that you could be around someone that has COVID, breathes on you. If you don't wear a mask, you get infected. And while you won't get sick from it because you've been vaccinated, presumably, because again, 95% effective, you could be one of the 5% that still gets infected. But let's just assume you don't get infected. You, however, could shed that virus that you have and won't get you sick. You could get somebody else sick by shedding the virus. So until such time as there is herd immunity, which, by the way, herd immunity is only valid in discussion related to vaccines. People that talk about herd immunity related to letting an illness burn through a population, that is absolutely not what herd immunity is. So until such time as we hit herd immunity, then we can start talking about backing off on the hygienic measures, the pandemic, what did you call it? I love that. The pandemic.
Good pandemic behavior.
Good pandemic behavior. So, and hopefully, I would imagine by late summer, certainly by this time next year, we're not going to be talking about this, if all goes well, but we'll see.
I want to ask if you can promise that.
I can't, I know.
Yeah.
Jean asks, are we expecting a surge in cases after the holidays? How would you answer that, Sue?
Well, I wish I could predict the future, or maybe I'm glad I can't. We were fully prepared that there was going to be a bigger surge after Thanksgiving, and so far, so good.
Yeah. There's, a lot of news from throughout the country that's a little concerning. Southern California right now is in a world of hurt, and I don't know that they've actually come out and said it's because of Thanksgiving, but I think in many cases it's traceable back to human behavior and just deciding not to do those basic measures. And I know there's a lot of conversation in England right now about this mutated virus and that sort of thing. And the article that I read, I think it was from the British Medical Journal, has stated that yes, while there certainly are mutations, there's no question. In the end, the feeling is from the scientific community in Great Britain that it tends to go back to just people letting their guard down and going out and doing their thing. And so it happens that we're seeing the mutated virus, but we wouldn't know there was a mutated virus if the infections didn't take place to begin with, I guess.
I think what we understand is that the simple behaviors are really the key, and you know, COVID will love it if we're all tired of staying home and not interacting with others. It will take advantage at any opportunity because it's very efficient at spreading.
Well, yeah, and that's the thing is, you know, the virus is a living thing. It's not a sentient living thing. It can't think. But living things do one thing and one thing only, and they live to procreate, basically, to create more copies of themselves. And that's how it happens. So if we can help break that chain, that's the way to do it. Have there been any studies on whether or not a person who has already had COVID can still be a carrier and continue to spread the virus?
I don't know the answer to that.
I guess the way that I would answer that is the concept of being a carrier, generally speaking, the way we understand the natural history of this disease is you get infected with COVID and it replicates and does its thing. And while either 2 days before you're infectious and up to 14 days after you've gotten the infection, that's when the virus can be shed. But after that 14-day cycle is complete, you're not carrying around with latent virus. That's my understanding of it. So you wouldn't, after your course is done, that's why we tell people you can be out of isolation after the 10 days beyond your first symptom or the date of the test, because by that time you're no longer spreading live virus that could cause a problem. Could you please revisit the importance of masking in relation to reduce viral load exposure and case severity? Yeah, that's something that we talked about. You know, I find that all the things that we've talked about over it's been 9 months since we've been doing this, and I find that so much of what we've been talking about is in many ways rhetoric. It's trying to appeal to people to listen. We think we know what we're talking about, even though we don't suggest that we're experts. But wear those masks, things like that. Why does masking work? And despite all the garbage you've heard about how masking is unhealthy and all that stuff, which is silly, the reason that we talk about masking working is even if it's not 100% effective, which of course it's not, if you have a mask on and I have a mask on, even if we somehow manage to have a perfect storm where a little bit of virus comes out of you and it manages to get through my mask and it comes to me, the amount of virus I'm getting, which we call the inoculum, how much virus we're getting is so small that it will cause either minimal disease or no symptoms at all. And that's good and that's bad. Good news is you don't have any symptoms, you're not going to get sick, you're not going to be hospitalized, you're certainly not going to die as a result of COVID. Bad news is you can have a false sense of security and you can say, okay, see, I feel fine, I didn't have any issues, I'm going to take off my mask. Now I had this virus that at low levels is it within my body, but I talk to you or I sing at you, you could get it from me. So we do know, we've seen it here at the hospital, we can trace it back. We ask questions about what masking behavior has been, exposure to people, sitting in a car together for 10 hours, things like that. And we've seen that people that have big exposures to virus have a much higher viral load and they do not do well. So masking, aside from being good practice in this pandemic, can help you to not get as sick. Hope that helps. Is there a sign-up sheet for the vaccine? I guess from Door County Medical Center perspective, not yet. Right now we're first going to be seeing vaccine on the ground. I know we've seen it in other places, but we first here in Door County are going to be seeing it the next day or so. So we're going to be working on getting the healthcare workers, nursing home residents, first responders, all those folks. We're going to work on getting them vaccinated, and then as time goes on and we work down the prioritization list, then there will become a time for a more general public. But Sue, what would you say from the public health perspective?
Yeah, we're not making a list, taking any names. What we know, though, is just as Dr. Heise described, the first dose allotment goes to the healthcare workers and long-term care facilities. So those are the priorities, and that's the only people we can give vaccine to begin with. And then the next tier. And we know that as vaccine supply increases, recommendations for who can get vaccinated will be modified and expanded.
Yeah.
So, like most things in this pandemic, it's sort of subject to change. And we have a plan for right now when we get our first doses of vaccine, and we'll go from there.
Yeah, yeah, and my best guess is, as far as general population, if you're a 40-year-old, otherwise healthy individual that does not work in healthcare, you're probably looking at, my guess is March, April, but that's just a guess. That's all that is. I mean, we may end up with a lot more capacity as Pfizer and Moderna pick up their manufacturing capability. We may see the ability to get to it faster, which would be wonderful. But I think just trying to at least put forth the timing that we're seeing right now based on the information we have is important.
And then kind of going back to, it's not just the doses, it's we got to have vaccinators too. I was just
good
sort
point.
of getting a little
very good point.
Anxious in my stomach when you said we might get all these doses. Yeah, we want those doses. So for public health, obviously the small amount of staff at public health are not going to be alone in vaccinating people. We have a task force that's been organized by Dan Kane, who's been honestly my best friend in this pandemic, and he's the county emergency manager. And so he's got us all in a group talking for the last several weeks, and that includes hospital reps and emergency services. So that crew has helped us with our seasonal flu clinics, and that was practice for giving pandemic vaccines. So we're going to ask them to help us again. And also we'll be getting volunteers. Chris Hecht from Sister Bay Fire has an amazing ability to attract volunteers, and he's really helped us with our flu clinics. So we've got those folks lined up to help us and get vaccine out as fast as we can get it, hopefully.
So we've got a lot of questions that I'm scanning through here. So I want to throw one that you can answer, Sue, so that then I can look to see what else is here.
Okay.
And this is more of a I guess a guesstimate, or how do you feel? Why are testing numbers down 50% compared to a month ago? Any thoughts about that? I know it's just what's your sense of it?
I don't honestly have a sense about it. I hope that people with symptoms are getting tested. Somehow people are less symptomatic, perhaps. I don't really have a guess. I've wondered that myself, I'll say that.
Yeah, I think too, and it seems like part of it, I think, is COVID fatigue. People are just sick to death of this, and they just don't even want to go there. Mm-hmm. I know that one of the things, we have a team now that is calling our positives through the hospital, because we also at the same time are screening people who might benefit from the monoclonal antibody treatment. So I've been relieved of that duty, thank heavens, because it was getting to be quite a lot. But before I had that duty removed, what I was noticing is a lot of people were saying it just felt like a cold. Mm-hmm. And so they were, and that is the tough thing, is, you tend to, a lot of us, myself probably included, if it weren't for COVID, you would sort of say, well, it's a cold, you wouldn't think anything of it, and you'd go about your business, and that's about it. The difference this year, of course, is that very often cold symptoms end up being COVID, and even if you feel fine and don't think it's a big deal, again, the whole thing is, we can't stop the cycle of propagating the virus if people just say, well, I think it's just a cold. And especially if you have someone that doesn't feel well, then they go into a confined space and they might take off their mask. That's how spreader events happen. Because again, the virus is just mechanistically is looking for ways to get from host to host to host, and it will find a way. So that I think might be one of the reasons why testing is down, because I think there's a little bit of that. And I worry too that people are saying, I'm hearing enough now, or I've talked to enough people that they had to quarantine for 14 days or they had to isolate for 10, and they're saying, I don't even want to go there. So I'm going to do my best to kind of fumble through. And that's, I guess I would say that's understandable to some degree, but at the same time, it does not help the community at large. It becomes a public health nightmare.
Right, it would,
Yeah.
It certainly is understandable, but I encourage everybody to get tested, to know where you're at.
Exactly.
So we can stop the spread.
Here's a quick question. Jeff asks, is the emergency room overwhelmed? No, thankfully not. We've been very busy, but not overwhelmed. I wouldn't use that word. Talk about allergies, please. The word is that if you've had an anaphylactic reaction to medications, you might not be able to get the vaccine. What I'll say is if you've had a significant reaction, anaphylactic or just a very significant reaction to injectable medications, then you should probably hold off on getting the vaccine. But that's about it. So for example, if you say, well, I get a really bad reaction if I find out that there's a nut in the cookie that I ate, that's a different situation. So that wouldn't preclude you from getting the vaccination. So I think that's one of those things where we'll know more. I know that, one of the things that I roll my eyes and get frustrated about is in the press. It's a great story to be able to say, oh, look, this Pfizer vaccine came out, and look, there's 3 cases in, was it Alaska, where they had anaphylactic reactions. And of course, you wish the best for the people that went through that. But if you think about 3 people in the context of all the many, many tens of thousands that are getting it, I think we have to, sooner or later, we have to decide. Again, it's all risk. We have to decide, are we going to continue like this, or are we going to give it a shot to try and get past this? Would you?
Yeah. So in the study I read, the article I read about the study was there was someone in the placebo group that also had an anaphylactic reaction. And what we know about vaccines and what we've always known is there is that possibility to have an anaphylactic reaction. And certainly if you know you're allergic to one of the vaccine components, and what I read, was just a list of chemicals, so I'm not quite sure how you'd know that, but if you do, you shouldn't get the vaccine. We've always had the emergency drug and protocol to deal with anaphylaxis at public health. Now we're quite aware of it right now. Mm-hmm.
Yeah, and really what the studies, the phase 3 trials that went through and ultimately resulted in the emergency use authorization, what those showed is the incidences of those kinds of side effects were on par basically with the flu vaccination and other vaccinations. So they weren't found to be significantly higher. So I think one of the things that's really important for folks, if you don't already have a healthy sense of it, is just the amazing accomplishment that this vaccine being available this quick. I mean, if you think of it, I was thinking about this before I came, Sue. If you think of it, we didn't start doing these Facebook Lives until I think it was early March. Mm-hmm. And so we're about 3 months from there now. So 9 months ago, we started doing Facebook Lives as we started talking about this pandemic, and we didn't know anything about it. Here we are 9 months later, and people have been vaccinated against this. Mm-hmm. Prior to this, the quickest vaccine to market had been the mumps vaccine back in the 60s, and it took 4 years to come to market. So this is an astonishing thing. And the thing that's the most important to understand is that there were no shortcuts. This went through every step that any other vaccine would go through. There's a couple of big differences. One is resources were totally unlimited. I mean, it basically was back up the money truck because this is a global pandemic and we've got economies that are crumbling. We have to get on top of this, aside from the fact that people are dying. The second thing is that, especially with these messenger RNA vaccines, there's no having to grow culture medium. There's no putting it into chicken eggs and having to grow that and culture it and continue to allow that time for medium to grow. So it literally goes from the beginning to the vaccine. So it's really kind of an astonishing situation.
And it's gone through the same safety trials as other vaccines.
Everything, yeah. Nothing, no shortcuts. Here's a good one, Sue. What would be your advice to those gathering with non-household members because they've already had COVID and therefore think it's okay? Is it okay or safe?
It is still risky. So there is a lot we still need to learn about reinfection. And there have been reinfections, although I believe they're rare.
Yeah.
But there have been reinfections, and there's still a lot we don't know.
Yeah, that's absolutely right. And that's the hope. One of the big questions that people will often ask is, do we understand, and I think someone did ask on here already, is this vaccine a one and done? Is it a sterilizing immunity like measles, or is this an annual or every 6 months? And I think the answer is we don't know. I think the Dr. Offit, who I've referred to before, their take on it is that you're probably looking at about every year. But again, we still don't know. I mean, these are things that we literally are learning as we go. As it turns out, there's some stuff behind viral pathology that indicate that this virus may actually be a good setup for sterilizing immunity, because what they call it the latency period, the time that it takes from infection to symptoms is longer. Influenza, as an example, once you get influenza, you've got the symptoms pretty quickly. That's kind of the whole thing when people say this is just like a flu. It's not, because you can't spread influenza before your symptoms are showing up. It just doesn't happen that way. So by the time you're sick, you're in bed and you're not necessarily going to be spreading this. You're going to be in a very small thing, whereas with COVID, you can be spreading it for a number of days before symptoms show up. So that latency, that amount of time, actually helps the body to generate immune cells, B cells, T cells, things like that. So that tends to suggest that we'll be able to generate a more robust, long-lasting immune response. But again, still not yet known. What's the difference, or is there a difference between, this is a good question, between a side effect and normal immune response? That's a great one. So a lot of talk about when someone gets, as an example, the Pfizer, the word on the street is Pfizer vaccine, you get the first shot and there's not much of anything, maybe a little bit of achiness at the site, and that's about it. Then the second shot that you get 21 days later, people are having what they're saying is severe side effects. And what they refer to as severe side effects is bad headache, fever, muscle aches, fatigue, tiredness, things like that. But it's gone in about 12 hours. So the reality is those symptoms that I just mentioned, those aren't a side effect of the vaccine. That's what your body does when it is trying to fight off a bug. When you've had the stomach flu, when you're getting sick and you start throwing up and you have diarrhea, things like that, you feel crummy, you feel wiped out, you have body aches, you feel terrible. That's the body's inflammatory mediators, these cytokines that are flowing around, getting an immune response mounted to fight off that virus. So in that sense, these things are not side effects of the vaccination, they are the body working. So if you wake up in the middle of the night after your second shot and you say, oh my God, I have body aches, that sort of thing, you can turn over to your spouse and say, it's working. So that's one way to think about it. Now, obviously that doesn't, I'm sure like anything else, there's no free lunch. I'm sure there will be people that will have more side effects than that or more symptoms than that. So not to diminish that, but I think in general, I'm kind of just psyching myself up that I'm going to feel crummy, and I'm purposely going to wake up my wife and say it's working. Because if I can't do anything else, I can make her miserable, right? So, okay.
Yeah, for years we've known if your arm gets sore after that vaccination, it's working.
Right. Let's see. If you've had COVID, should you still be vaccinated?
The general answer is they're saying yes.
Yeah.
I imagine there's individual differences that you might want to consult your healthcare practitioner, but do you have more to add, Jim?
No, I think definitely you should. I think the fact that the biggest fallacy that we hear on a pretty regular basis is someone will say, I've had COVID, so I'm good. And the answer is you're not good. You can get it again. You're not free of you aren't good, basically. So hopefully the vaccine will help complete the immunity so that you won't get it again.
Right.
Let's see. Yeah, Jen asked, how many people in Door County have gotten the virus more than once? I don't think that I didn't say, I don't know that answer. I was going to say, I don't think we know. I don't have that answer. I don't think it's high, if at all.
Right.
So, I mean, we're talking one, if there was any, and I can't even think of one when I was still calling all the positives, and you and your team have called.
I can't think of any, actually, at this point.
Let's see. What will each tier be as far as people included in that tier? I can't quote those. I mean, you can look that up on cdc.gov, I think, and they'll have that. I do know, Sue and I were just talking before we started the live, that one of the advisory groups from the CDC just came out with a new recommendation for Group 1B, which is after the healthcare workers and that sort of thing. And it has yet to be approved by the CDC, so we don't know if it's actually going to happen, but they recommended 75 years of age or older would be in 1B, and then essential workers, which would include firefighters, first responders, grocery store workers, things like that. Teachers, thank you.
Yeah.
So
yeah, some of those determinations aren't quite finalized, as I understand it.
Okay. Oh, that's an interesting observation. I don't know if, I mean, Shelley posits that she says for her it's obvious that with the number of dual home residents that left Door County in October is why the numbers are down. Maybe. I don't know that it's obvious, but it's, maybe. That's a good thought.
Mm-hmm.
Let's see.
And we have less visitors, so maybe less viral activity.
Yeah. I think if we've learned anything about this virus, nothing is obvious.
Right.
Right. It's, and I'm not saying that to be snarky at all. Not at all. It's just I use that word a lot, and that's something I've learned with this.
It sort of seems like just when we get a plan, then it has to change.
Yeah.
For
yeah.
some
Exactly.
reason.
Some people are asking specific questions about, so in my case, if I have this or that with the vaccine, it's hard to make generalizations, and so will, if between public health and your regular doctor and us, if we're involved in giving your vaccine, we'll do our best to try and advise you appropriately, but each case is different. Can we explain messenger RNA? Absolutely. So. You want to explain messenger RNA?
No, thank you.
And I'll try not to geek out. This is where my wife will just sit and roll her eyes because I get excited about this sort of thing. So I think everyone knows what DNA is. I mean, DNA is basically the master molecule that creates life. That is involved in all life, and that's basically it's kind of a coiled ladder. It's a chain of what they call nucleotides, which are proteins that go together, and depending on the way that you order those, they create proteins. When DNA splits apart and becomes RNA. So DNA is 2, RNA is 1. And RNA, messenger RNA, is what gets into the cells and is actually able to encode for a new protein. So what the very clever people in these companies have done, and by the way, they've been working on messenger RNA vaccines since about 2005, so it's not just now. Now is the right time to actually employ the technology. What happens is the vaccine makers, they encapsulate this messenger RNA into these little, they call them lipid nanoparticles, literally small little packets of fat that attach onto the outside of the cell. The cell takes those in, releases the RNA. The RNA then goes to a component of the cell where the protein is created. And in this case, the protein is essentially the spike protein of what's on the outside of the coronavirus vaccine. It's not coronavirus virus. It's not part of the virus itself. It's just the spike protein. The spike protein is what helps latch on to other cells and to get in. So by doing that, it's put out, that's expressed on the outside of the cell, and the body says, wait a minute, this is a foreign protein, I don't like this, and it goes and it attacks it, and it generates an immune response. So without getting COVID, you have the body generating an immune response to a protein that looks like what's on COVID. So the idea is, now that that immune response has been mounted, if you should get COVID later, it's already seen it in the guise of that fake spike protein, and it attacks it. And so it gets rid of it. So that's kind of how messenger RNA works. The other thing that I've seen comments is, well, I don't like that idea because we're messing with our DNA. You're going to cause mutations in your DNA. The reality is the DNA is located in one place and one place only. It's in the nucleus of the cells. It is a very difficult thing to get into the nucleus of the cells. Messenger RNA simply can't do that. A visual that I thought of, think about messenger RNA as like a piece of, if you do any kind of cooking, either a piece of rosemary or some tarragon or something, where you hold it by the stem and you pull off the tarragon leaves, and then you're left with this naked stem. That's kind of what messenger RNA is. It goes into these, they're called ribosomes, into the cell, and it gets unzipped and it creates this protein, and what's left is this stem that's worthless, and the stem just dissolves. So there's nothing that can get into the nucleus at all to even affect your DNA. So no worries about creating genetic defects. You're not going to grow a third eye or anything like that, at least as far as we know right now. And I'm seeing video of myself in delay, and my hands are doing what they always do, which is all over the place.
I'm really glad you answered that question.
More than you wanted to know. Will you need 2 vaccinations? How far apart? Excellent question. Yes. It's a 2-part vaccine. You get some degree of immunity after 10 days of the first one. They say maybe 50% or so. With the Pfizer, it's 21 days later. Correct me if I'm wrong. And the Moderna, which we're going to be getting here, it's 28 days later. And that boosts the immunity and completes the immunity, essentially. So if you're thinking you're going to get one and be done, don't waste anybody's time. You need to get both. It's important. Would you agree?
Right. And I think people sometimes are confused, and they think they got to get the second dose right on that 28th day, and that's not the case. It's on or after that day. You just can't be before. You have to let your body build enough immunity to be ready for the boost. And I'm not saying wait 6 months. Don't do that,
No.
please. But, you know, as soon as possible after the 28th day.
Yeah.
Yeah.
Karen asked, does our hospital and clinic have all the treatments for COVID infection, including the monoclonal antibodies? The answer is absolutely yes. So as I mentioned, what we're doing is when people test positive, as the ordering person that orders them, our staff is calling those people. There is a very specific list of people, age-wise, health history-wise, that would qualify for the monoclonal antibodies, and they're offered that treatment. And the treatment is of no cost. The government is taking care of that. So, so it's really kind of a neat thing. So we have 2 different ones. One's called bamlanivimab, and one is, we call it Regeneron because it's got actually 2 antibodies. So bamlanivimab is 1, the Regeneron is 2 monoclonal antibodies, and we've gotten a supply of both. It's basically divvied out to us from the state on a weekly basis. And I think we've done probably maybe 20, I want to say. Not everyone wants it because they say, no, I'm feeling better, I'm good, which is fine. But no, we're really fortunate because we are actually able to do pretty much everything that you would get as far as known treatments for COVID, we do right here in Door County. Let's see, we're getting up to 10 to 7, so I'm going to try and scan through some of these questions here.
While he's looking for the next question, I'm just going to mention that Public Health is going to be putting out a survey asking the public, it's like 3 or 4 questions about COVID vaccine. Do you intend to get it? And some of your feelings about that and how you get your news and that sort of thing. So when you come across that survey, please fill it out. It's going to be on Facebook and on our website. And if you work for the county, you'll get it in an email.
Thank you for that. That's definitely going to be helpful. Hannah asks, if you have a pre-existing condition, and she lists pulmonary valve stenosis, are there increased risks in getting the vaccine? I want to get it, but not sure when I'll be able to. I don't know that there's any increased risk with those health conditions. In fact, generally speaking, if you have medical comorbidities, those are the folks that if you get COVID, you may not do as well. So I would say most certainly get it. The interesting and helpful thing is when it comes time to vaccinating, everyone will be given an information sheet to read. So it's going to specifically ask you, do you have these things? Because there's going to be a relatively short list of things that are absolute no-nos. So you'll know before you get the shot. It's not just a matter of stick out your arm and we'll give it to you and then after the fact say, oops, not at all. We want you to go through. We want you to know what the risks are for everyone. Let's see. I think we're coming to the end of this. Oh yeah, Jen, this is a great question. How long will headaches and fatigue last after COVID? I still have them after 2 months. Thank you for that question, and the reason I'm thanking you is because it allows me to kind of expound on something else that's about COVID. It's hard to say how long it'll last. We've been seeing folks that have what's been referred to as the long COVID, and I don't know who coined that, but that is what we've been seeing. Is there are some people that develop fatigue, headaches, things like that. One of the things that Dr. Offit, who I keep referring to, has mentioned, which is so true, is what's scary about this virus is that unlike other viruses, unlike other coronaviruses, just the common cold, it comes, it goes, and you don't think about it again. This one has the capacity and the ability, and it often does, cause long-standing effects in the body. It can cause, at its worst, things, what's called vasculitis, which is the inflammation of the lining of blood vessels, and that can cause all kinds of trouble. So in that sense, it's a really scary virus. We have people that are developing congestive heart failure weeks after having had the virus because their heart has been taxed. When people are in the hospital sick, we're seeing blood clots in the lungs, in the legs. We're also seeing after they clot and we treat the clot, we're seeing people have bleeding as a result of the the blood thinner that we put people on. So it's scary business. I mean, these are things that we haven't seen. So I will just say, as kind of a, when people that don't know say, this is just like the flu, I'm here to tell you, and my colleague who I work with, Dr. Bernard, who takes care of virtually all of our COVID patients, will tell you this is not the flu in any sense of any imagination. I saw a post on Facebook where somebody was comparing that there were news stories, I think back in 2016 or something, about it was a bad flu season and how people were intense, and people, basically the gist behind that post was scoffing at this, saying, oh, see, it happened back then and no one made a big deal about it, and now we're making a big deal. I was practicing back in those years. This is not what that is at all. I'm here to tell you. So thank you for that question. That really is, it allowed me to expound, which Sue knows I expound.
I like it. And it reminded me that so often we focus on the side effect of the vaccine, but we need to remember what the disease is all about.
Yeah. Gina, I think this is going to be the last question. Will people who have been vaccinated get a verification card to prove you were vaccinated?
Yes, they will get a card. It will tell you what vaccine you got, and it will tell you when to get the next dose. We will also keep track of that in the Wisconsin Immunization Registry, which is a secure website for any vaccine provider. So if you get your first dose at Public Health, but then, I don't know, for whatever reason you want to get the second dose at Door County Medical Center, they'll be able to look you up and see what you got and when is the appropriate time and which vaccine.
I'm going to show my age. Remember the Dr. Seuss show, The Sneetches? The book, The Sneetches? Was these people, they had the stars upon ours, where they had stars on the belly, and it was sort of the in crowd. We were talking about that. It's just sort of, are people going to get a card, that sort of thing? It's like, it'll be the Sneetches. You're going to have stars and the no stars. So anyway, that's just me being silly. Well, so what are you going to do for Christmas?
Well, I'm going to stay home and hopefully not work.
Yeah. Same here. We're not doing anything. Just going to be home with the family, and first time in many years, actually. Yeah.
Yep.
Well, I'd just like to thank everybody so much for joining us tonight and asking such excellent questions. And Thank you so much, Sue, for joining as always.
Thank you.
I wish you a very Merry Christmas and Happy New Year. I'm sure we'll be talking before those events, but nonetheless.
Well,
And I want to wish everybody out there a very Merry Christmas. You know, we've been through a lot over the last 9 months, and I really do believe that we're seeing a light at the end of the tunnel. And I think I really would love to encourage people, let's do what we can to make Door County an example. Let's wear those masks. Let's try and stay 6 feet apart. I believe we can do both. We can have our cake and eat it too. We want to get together with friends. Let's do it very smartly. Stay 6 feet apart, wear those masks. Do get together with friends very sparingly, but I think we can set an example for the rest of the country. And let's have these numbers not go back up. So Merry Christmas, Happy New Year, and we'll talk to you in 2021.